loss of oral tolerance.
Oh, yeah.
HLA-DQ2 and HLA-DQ8 does not bind with the gluten peptides until you lose oral tolerance. So we're back to the gut again. It doesn't matter if you carry DQ2 or DQ8. It doesn't matter. It doesn't mean you're going to get celiac disease. It does matter in some ways, like if mom has celiac and baby now has the genes. If you do the genetic test and baby's got the genes that mom has, well, for sure, you need to understand that baby's going to be sensitive and you want to reduce the exposure. And there's a whole protocol to, about what you do for that. So it does matter. The genes do matter. But for an adult that does a genetic test, you get the gene, it doesn't mean you're getting the disease. It means that if you cross the line of tolerance, you're very likely to get the disease. And in that case, it's within 7 years. Once you cross the line of tolerance,
that's a long time.
Once you cross that line of tolerance and you start making antibodies to peptides of wheat or antibodies to an enzyme called transglutaminase 2, sorry for the geek words, but once you make those, and you don't make those antibodies until you cross the line of tolerance. Once you cross the line of tolerance, and if you got the gene, you're getting celiac disease. But now, with all of the inflammatory things that we're exposed to, our threshold is much, much lower than just 10 years ago or 20 years ago. And we've always said that celiac, 35% of the population has the genes, 1% gets the disease. Well, now we know in some cultures, for Brazil, for example, it's 43.7% of the newborn children have the genes, DQ2 or DQ8.
Okay.
And now it's up to 4% get the disease. Now, it was 1% 10 years ago, 15, 20 years ago, but it's going up because more people are crossing oral tolerance. They're crossing that line of tolerance. Once again, we're back to the gut. We're back to the gut.
How important is it to know what genes you have? And so some people, there's a big fear factor, like, don't tell me,
Absolutely.
I don't want to know.
Absolutely.
But why is it important to know?
It's important to know because when you know, then you ask the questions, what are the markers that I can look for that would activate this gene? So if you have DQ2 or DQ8, you do the wheat Zoomer test because that's the most comprehensive blood test on the market today. And if you have elevated antibodies to wheat, you've crossed the line of tolerance, you get wheat out of your diet and get those antibodies down.